Thank you, Mr. Chair. Joe Hardy, Senate District 12, for the record. Senate bill, or Assembly bill, is proposed by Assemblyman Woodbury and co-sponsored or joint sponsored by myself. She asked that I be here and present the bill. The Dean of Touro Medical School, of the Osteopathic Medical School, asked me if we had anything to protect the immunosuppressed or immuno-incompetent children in the preschools or schools in the state of Nevada. And I had a blank look on my face, and I said, well, we can do something. And there are things that the school districts are doing, and you will hear from them today. If a child is on chemotherapy, for instance, we have sometimes what we call reverse isolation, where the person who's not sick wears the mask in order to prevent something, and you've seen those pictures at St. Jude's advertisements and things of that nature. We recognize that sometimes when we go into the hospital, we wear a mask and wash our hands and those kinds of things to prevent giving them something, but when they're out in public, they try to protect themselves. One of the ways we protect each other is through immunizations. And if a child is immunized against, for instance, chickenpox, then they're unlikely to give chickenpox to somebody else. And if the somebody else doesn't have the immune system or the capability of exercising their immune system to have antibodies, then they need to be protected, and that's the genesis of the bill. Now, having said that, I've talked with people, most notably this morning with Dr. Titus, as we were talking with our medical students and fellow physicians, that she was against the bill, and she had a very valid concern when you read the bill. She does not want anybody to know who has not been immunized because of the exemptions in the state law for religious reasons or for medical reasons. And I think that is a very rational, reasonable thing. And not only that, but as you read the bill, I would advise you to amend the bill because I do not want people to know what somebody else is doing from a medical standpoint.
We're in a classroom, or if we're in this room right now, and every single person, and it's great because we have so many medical staff in here, if every single person in this room but one has been immunized against a certain, say, chickenpox, the people in the room would be protected from chickenpox, even if one person had not been protected from chickenpox. So if that one person, isn't that one person who didn't get the vaccine more at risk than the rest of the room that has the vaccine? And what would we do with that information if we found out that, oh, there's a child in the room that hasn't been vaccinated against chickenpox? What do the other students who have received a vaccination do? Do they go get an additional vaccination? I mean, what happens with that information?
Mr. Chair, through you to the Assemblywoman.
And you can go direct.
Thank you, Assemblywoman Miller, for your question. Usually with a contagious disease, there's an incubation period. So, for instance, the person who's never had chickenpox and hasn't been immunized benefits from the rest of us who've had chickenpox or have been immunized with the herd immunity. It's unlikely that that person's going to get chickenpox because none of the rest of us are going to get it. But that person who hasn't been vaccinated will go someplace else, been exposed to somebody before they know that they are carrying the virus. And so then the incubation period goes on and they get chickenpox and they didn't know they were carrying the virus. And so you can actually pass the virus before you know you've got the disease.
Follow-up? So then is the bill to protect the one child who hasn't had the vaccination? If we're protecting the child who didn't have the vaccination, then what would the need for the notification to the other children who have had it be?
So this bill is not so much to protect the person who is normal.
Who is normal?
Who is normal. This bill is to protect the person who, for instance, would have chemotherapy, have their immune system cut down, or have an immune deficiency by birth and not be able to mount an immune response. So this bill is targeted not for the person who doesn't want ever to get the vaccine for either religious or medical reasons, as it were, depending on how you define those, but the person who literally can't mount an immune response. So if they get chickenpox, that child can't mount an immune response. So in 10 days or 14 days, when the virus is gone, for you and me, when we get the chickenpox, it could be fatal to them.
Follow-up for clarity? So for clarity, we're not suggesting mass communications throughout the school to say that there's a child here who hasn't had a vaccination. We're targeting those few individuals that would be the most vulnerable, as in the situation you said, that they just can't take the immunization, and of course they're at much risk because they don't have the immunity that other children have. So we would just be notifying that parent of that child?
I'm glad you asked that question that way, Assemblywoman Miller. You're going to hear from the school district who has been doing a rate, and they will, if you now call up Clark County School District, for instance, you can say, is there anybody, or what is the percentage of, and they will probably tell you that irrespective of why you're calling. And you're going to see how they are proposing to do this kind of thing as far as a notice. That could be email, that could be website, that could be person to person, that could be phone call, that could be any manner of communication that would allow you, the parent who's concerned about your child for whatever reason, to know what the immune status is of that particular school. Not by class, not by individual, but by the school. Does that help?
Yes. Thank you.
Okay, thank you. Ms. Titus.
Thank you, Mr. Chair. Senator Hardy, my concern about this particular bill is the potential, the unintended consequences of a bill such as this. And I'm hearing that there might be some amendments coming to the bill and change it. And I apologize I wasn't here at the start of your presentation. But for myself in a small rural community that has perhaps 8 kids in a class, maybe 12 kids in a class, for the whole, we have one third grade and maybe there's 12 kids in it. When somebody new comes in and for whatever reason, whether they have an immune deficiency and they can't have these vaccines, or for religious purposes, et cetera, they did not get their vaccines, then suddenly you get a new kid come in town. Now their call goes out to all people that go to school there that they haven't had their immunizations. When you only have one new kid that comes in, how are you protecting that? Now they know that kid, for whatever reason, medical, personal, religious, hasn't had their vaccination. I'm really concerned that it's a privacy issue and not intended to be that way, but how do you solve those kind of concerns?
Thank you, Assemblywoman Titus. Mr. Chair, you'll back me up that I already quoted her.
You specifically quoted her. And I actually might just make a suggestion at this point. Well, first off, the amendment is being uploaded to Nellis right now, so at least committee members, you should be getting it here shortly. Secondly, maybe at this point we could have Clark County come up and just explain their amendment, so that maybe that would help clarify.
That would probably be wise.
Thank you, because I looked to see if there was an amendment in here before I asked, and it wasn't in there.
I took your counsel to heart and recognize that it's very impossible to do the kinds of things that you're talking about. Otherwise, everybody knows, no matter how big the school is, when one new kid comes in. And so that is something that I don't see an easy way around. And that's why I say I'm going to throw myself on the mercy of the court, I mean the committee, and say this committee's collectively perhaps much smarter than, not perhaps, than me, and therefore the committee can figure out if they want to process this in such a way that we can protect the individual and the community and the confidentiality. Thank you. Thank you, Mr. Chair.
Thank you, Mr. Chairman. Nicole Rourke, representing the Clark County School District, and I apologize for the lateness of the amendment, but we just worked out some specifics with the bill's sponsor, and so we got it to you as quickly as possible. So our amendment looks at two different things. One, protecting the privacy of the student, no matter whether or not they have an immunization or not. Easy for me to say on a Friday afternoon. So for public school, we went to section 3.2. And in that last sentence, rather than just leaving it at the name of a pupil who is exempt, we said, or any other information that may lead to the identity of a pupil who is exempt from the immunization. So ensuring that we're not revealing really any data about it, we see it really as a yes or no answer to the question of whether or not exemptions exist in the entire school.
Thank you. If I might, Mr. Chair, a follow-up on that, I guess, because to me, I'm not convinced a bill like this is needed as much as when a family goes to any school, whether it be preschool or high school, et cetera, they receive a notification that you have an option to opt in or opt out of your vaccinations for X reasons, and so that any child that gets enrolled there should be educated that there potentially may be folks here who haven't been vaccinated. I think it's a more common sense approach to what you're trying to solve, and I don't know that we can protect these kids that go to the grocery store, that go out. If a parent has an immune compromised child, they need to be aware of that, because it's not just school where they're being exposed to diseases. I mean, it's life, and so this would not solve any of those problems, but yet make it perhaps very complicated and a danger for an individual child who's maybe not immune or maybe has a health crisis or whatever reason. And so I'm really concerned about it.
Thank you, Ms. Titus. Other questions from the committee? Mr. Kurla.
Thank you, Chair, and thank you, Doctor, for bringing this bill forward. What I wanted to find out was what prompted this? I mean, was there an incident that happened, or has there been ongoing incidents that would have created this bill? I mean, because there's always cause and effect, and this is the effect, I believe. So if you could elaborate on that.
Thank you, Ms. Assemblyman Carrillo. I'm glad you asked that, because now I can deny any problems whatsoever happening in Nevada, and I'm not going to use the word Disneyland in a sentence right now, because there haven't been any of those conditions or problems that have happened. So this is more a proactive approach to look at the child that we are probably going to have at some point who is immunosuppressed or immunocompetent, that will be exposed to many people, whether they're in the school or in the public. And those people obviously have been taught, and the doctors teach them, the kinds of things that they need to do to prevent themselves from getting sick. So this is not something that has ever happened in the state of Nevada, as far as I know.
So currently, how many states have this already in place in their law?
I do not know how many, but NCSL did some research, and I think it's Oregon that provides information to parents in a variety of ways online at the school front office, providing directly to parents via paper document and electronic document about immunization rates. And so they, again, similar to what Dr. Titus is talking about, talk about the rates as opposed to the individual. And I think if we were to do something, it would probably be in that way. And you're probably going to hear from somebody who wants to come up now too and say what's happening as far as what they're doing right now in the state of Nevada about the rates and what you can find out and what you can do. So this is, we are doing better and better with immunizations in the state of Nevada. And I think, and I can't answer your question directly, how many states are doing that.
But from this point, it's just Oregon that you're aware of?
But I know
through
for sure.
NCSL. Okay.
Good afternoon, Senator Hardy. I wanted to ask you, for instance, when we go to look at voting results, sometimes the precincts are so small they won't tell you the individualized breakdown of how the voters voted. Probably not a problem you've had in your elections, but for some of us with close districts, we're curious to know that. So my question would be, in a situation like this, is there any sort of carve out if a facility, accommodation facility or child care facility, say, only has a handful of students, where it might be kind of obvious if the parents just talk to one another to figure out who the one or more child is that's not immunized? Is there some kind of thought about maybe not disclosing in those situations?
I'm glad you asked that, Assemblyman Yeager. And this is where I think, to quote or misquote, depending on how I say it, Dr. Titus, Assemblywoman Titus, is we may not be, there probably is someone who is not immunized in this place, or we cannot say for certain that somebody is not immunized, or we can phrase that in such a way that we do not tell anybody anything, for lack of a better word. So we can say something about, everybody is, or we can say not everybody is. And I think that's about as close as you're going to get.
Well, and then I guess I just have a follow-up question to that. Isn't that already implied then, when they're initially being enrolled, that they have the opportunity to not be vaccinated? Or because they have to be told that, as I understand it right now. So the implication is, so anybody could already be at that school that is not vaccinated.
Thank you, Mr. Chair. We have to be vaccinated when we go to school unless we have an exemption. And so to Assemblyman Yeager's point, if somebody has an exemption, we could say simply, there are, or this isn't a completely vaccinated school.
Yeah.
Such a way that it does not, in that room of 8 or whatever, so we don't want to identify even the room. We would just say, the school is not completely vaccinated.
And I guess my only thing is at this point, I'm not understanding why we would even need to do that if the implication's there. But that's rhetorical. You don't need to answer that. I do have another follow-up question for Ms. Miller.
Thank you, Chair. My question is, when the term everybody was just mentioned, so in a school specifically, everybody includes thousands of people that are not children. So where do we then, when it comes to the privacy of the teachers, the staff, all of the adults working in the school district, where does that come into play? Is that the same? Do they need to be warned that there's adults who haven't had certain vaccinations, or adults who, maybe carry certain communicable diseases? I'm just wondering where kind of the reach of this would go.
Assemblywoman Miller, you just opened Pandora's box.
Probably not the first time or the last.
So yes, that's real. So how do we handle all the adults who are not, and I don't know that we have anything, but I'm going to look to my left and my right and see if anybody has a requirement that the adults have to be immunized against, quote, unquote, everything.
For the record, Heidi Parker, Executive Director of Immunize Nevada. California did actually recently pass a law for childcare personnel to be vaccinated against certain disease, clearly for the protection of those younger children, especially for babies who may not be fully vaccinated yet.
Nicole Rourke again for the record, not that I'm aware of, but I can get back to you with that information. I don't believe we do, though.
Follow-up question, Chair? I know there isn't currently, but my, just trying to be proactively thinking, the concern that a bill like this could reach into that arena. we're now, and again, we know there's a, you know, a lot of laws protecting us, our privacy. So when then at this point would the medical records and the vaccination records of adult staff be required or included that? Because medically is, I mean, we know chickenpox is more of a childhood a disease, but there's other diseases that it doesn't matter the transfer from adult to a child or child to adult. So that's why I'm wondering, would we, that's a risk I see.
I'm going to field that one.
Okay.
Joe Hardy for the record. Let's take pertussis. We now want to immunize grandmas and grandpas because of the little babies that they take care of. So your point on, you're exactly right. You know, at what point do we start saying that adults should be immunized against pertussis and have a stamp that says, yes, you should. And that's the Pandora box thing that I don't know that anybody in any state has done that. But again, I'm going to, because Nicole doesn't want me to call on her, I'll ask Heidi if she's aware of that.
For the record, Heidi Parker, not that I know of.
Mr. McCurdy.
Thank you, Mr. Chair, and thank you, Senator, for being here. I've received so many phone calls and emails about this bill, and you know, I've been really thinking along the lines of my colleague and Assemblywoman Miller as to the type of reach that we're going to begin to dig into. So let's just say that we have, teacher in government class or, some small math or English class that, may have a virus. And are we going to begin to start, asking those professionals to start, reporting, or are we going to allow parents to have access to their information that violates their privacy, which is going to lead to fear-mongering in the schools? And, I see it going a lot further than where it is now. And I don't know if we really want to open that box, for the matter that we just want to protect people's privacy and allow everyone a safe and, easy mind in their institution, wherever that may be. So, how are we going to protect their, them once, because it's going to come up. I can definitely see it coming up, a parent asking to request records, of, who's teaching their child. And, like, how do we deal with that type of situation, please?
Joe Hardy for the record. Thank you, Assemblyman McCurdy. I told you that the committee was smarter than me. How's that? I understand and hear your concern, and I think it's real. So this bill, limited as it may be, may open that door, and I respect the committee and what they would like to do with this bill.
Any other questions from the committee? If I could just ask one, kind of bringing us back to the actual bill, specific to the language, just for clarification purposes, what this bill is asking is that when the parent of a child is requesting to be notified, right? This isn't a blanket notification that the schools will be mandated to do. It's just when one of these parents or guardians requests that notification.
Mr. Chair, thank you. That is correct. You may hear from folks that it can be wider than that, but that is what the bill addresses.
Wanted to clarify one point. So the school district is neutral. We brought the amendment just to ensure that we could comply with the bill should it pass through your committee and out of this body. So we wanted to just ensure that Section 3.1 was also amended regarding notification of the ability of a parent to make that request to ease our process, right? We would put it in our annual set of notifications along with our notice of how do you register your child and how do you, sign up for the school bus and things like that. So just for clarity, we wanted to ensure two things. One, we could get that information out easily, and two, that we were protecting the privacy of students, and then we were really looking at a yes-no answer. So just wanted to clarify that point. Thank you so much, Mr. Chairman.
Go ahead.
Thank you, Mr. Chair. Heidi Parker for the record. So as part of Immunize Nevada's mission to provide trusted information to Nevadans, we collaborated with the Division of Public and Behavioral Health Immunization Program to develop and maintain a web-based searchable portal where parents can find the immunization rate within their child's school. This portal is housed at vfcnevada.org, and it identifies the percentage of the exact number of pupils and children immunized in accordance with state requirements, and is self-reported annually as required by NRS 392.435 and NRS 394.192. Rates are required to be reported by December 31st to the Division of Public and Behavioral Health, and we have collaborated with the Nevada State Immunization Program to ensure that this online form fulfills this mandate. NRS 432A.230 and 432A.235 requires immunization rate information to also be reported by child care accommodation facilities, and we are currently working with DPPH to include this facility information in the same searchable portal. The Nevada State Immunization Program can only dedicate 0.25 FTE to school enforcement issues given the multitude of their daily responsibilities. So by recently creating a full-time school immunization project coordinator position, Immunize Nevada has been able to assist with this human resource gap by collecting the rates, following up with the schools who haven't reported, ensuring the rates are available to the public. We provide school-level technical support, and we also provide resources for their families. By mandating these rates through NRS and making them accessible and searchable online, Nevada is actually at the forefront in making immunization rates fully transparent. As you heard, not a lot of states are doing that, and if they are, they're not searchable or as publicly accessible. We have made this system as simple as possible for not only the school to report, but also for the parent to understand the rate. If a school reports a 99% immunization rate, then the remaining 1% would be accounted for through either a religious exemption, a medical exemption on file with the school nurse. Schools potentially could also have conditionally or non-compliant students enrolled, and those tend to be extenuating circumstances, many of which you've already heard in testimony from today. Access to this data actually helps Immunize Nevada identify schools and communities where we need to focus our efforts to ensure that the desired level of herd immunity of 90 to 95% is reached. By providing these targeted resources, we had a school pilot project that posted an improvement from a 9% to a 2% unvaccinated rate in their 17 identified schools. And because of that success, we have made this a permanent project at Immunize Nevada. Additionally, by raising awareness of community vaccination coverage during the 2015 measles outbreak and the importance of the MMR vaccine, Nevada saw a 23% increase in vaccination over that same time period over the previous year. So we are in full support of transparency of rates, but as stated, these resources do already exist. We know school nurses currently work hard, very hard, to enforce and ensure their students are fully vaccinated. They're some of our strongest partners in ensuring a healthy and vaccinated population, and we appreciate the work they do. Additional concern is with the threat of the loss of prevention and public health funding under the Affordable Care Act. Nevada's immunization program could lose half of their federally funded budget. This loss would also impact Immunize Nevada's programs, and duplicating these duties that already exist during a time of funding uncertainty could add unnecessary burden on our state. The intent of this constitutes good public policy, and we also support helping parents increase their knowledge of these rates, and we want to also empower them to advocate if their school doesn't report or have a lower rate. But we know it's duplicative. As a coalition, we do have partners that both support and oppose this, so we are neutral.
Thank you, Mr. Chairman. Eric Jimenez for the record on behalf of the Southern Nevada Health District. Senator Hardy alluded to it in his testimony, but we are in full support of this bill insofar as it has the potential to protect the most vulnerable members of our community who don't have the ability to produce antibodies or immunodeficient. So we are fully in support of what this is trying to do. Thank you.
Hi, I'm Joy Davis. I'm a resident of Reno, Nevada. I'm a business owner in Sparks. And I came because, although many of my concerns have already been addressed by the committee, I came because I had a pretty strong consideration that a bill like this might create division in our schools. Prejudice, labeling, suspicion was one of my biggest concerns. And the reason for this is because most parents know that there's at least one child that is exempt in the school. And so I don't understand why a bill like this is necessary, whereas I see the potential for harm from the bill to be greater. The other consideration I had, which like I said, many of them have already been addressed, was a lot of these children that are immunocompromised are exposed to a lot of adults that have not had these vaccines. I know myself, I'm 45, so I've had quite a few, but not all of them. I have some natural immunity from chickenpox. But so I'm around babies and children, and of course I'm careful if I feel like I'm sick or I'm getting sick. But my point is the immunocompromised are around adults and other children at parks and the grocery store and restaurants, unless the parent is not putting them in the public at all. So I guess I'm not understanding the necessity, and I'm seeing the downside of the suspicion, because it's human nature to ask the question, well, who is it? Who is that person? You know, they're not going to get a name, they're not going to get any identifying factors, but most people are curious and want to know, and then they try to see who would that be, and asking the questions and start labeling and start profiling and saying, oh, is that somebody who is an anti-this or anti-that? So that is my concern. Thank you.
My name is Sarah Yelowitz. I'm a parent. I live in Reno, Nevada. And I would like to ask the committee to vote no on this bill. As Joy mentioned, I do see a lot of downsides to the bill. I think that parents already know that there's a religious exemption in Nevada and a medical exemption. So in any school, there are probably several children who have exemptions. And I believe that this bill is unnecessary. Most adults would be technically considered unvaccinated because most adults are not up to date on their booster shots. So children, if they leave their house, they are around unvaccinated people all the time anyway. And the unvaccinated children, they really do not pose a risk to anyone. From my personal experience, I volunteer a lot in the public school, and I just know that they're very, very healthy usually. And the parents of the unvaccinated children, usually they're highly educated, and they're usually very, very health conscious parents who've really put a lot of thought into it. So I agree that I think I don't really see a purpose to it. I think that anyone who's going to send their child into a school, they know that some children are vaccinated and some are not. And it doesn't really matter. So I think that what it would do is create an atmosphere of fear and suspicion that is not productive for a learning environment. And I would also like to add that the vaccinated children, there are a lot of live virus vaccines such as rotavirus, the MMR, chickenpox, the flu vaccine, all of those shed. So the children who've been recently vaccinated, they also would pose a risk to the community because those live virus vaccines do shed for a period of either weeks or months, and I didn't see any language in the bill to address that concern.
Good afternoon, Mr. Chair, members of the committee. I'm Michael Hackett with Alris Consulting. I'm here on behalf of the Nevada Public Health Association, and I just want to put on the record that we are neutral on the bill. Originally, I had signed in that we were supportive of this bill, but I just received a notification that upon further consideration by the Public Health Association, we are neutral, so I just want to make sure the record reflects that. Thank you.
Thank you for your comments. Next, please.
Mr. Chairman, members of the committee, Jessica Ferrato here on behalf of the Nevada Association of School Boards. We are here neutral on the bill. We think that this is duplicative of what is already offered for parents and families in our school districts. We support all of the facts and information that the Immunization Coalition has previously presented and feel like they're doing a very good job about maintaining this data and providing it as needed. We would be supportive of an amendment, the Clark County School District's amendment, but I'm still not super comfortable with the bill in general. So if you have any further questions, I'm here to answer them. Thank you.
Thank you for your comments, please.
Thank you, Mr. Chair and members of the committee. For the record, my name is Mary Brzezinski. I'm here representing Nevada Association of School Superintendents and Nevada Association of School Administrators, and we are also neutral on the bill with the, if the bill includes the Clark County School District Amendment. We like the part that helps protect the identity of the students, we think, a bit more. Thank you.
Thank you. Anybody else to speak in neutral on this bill? Well, I would ask the sponsor to come back, but none of them are here. So I am going to close the hearing on Assembly Bill 200.